Today I am presenting the video about the marathon study. Marathon is a skin protector which is applied around the skin. So this is a case series in which we have evaluated the acceptability of a liquid skin protectant in the clinical setting. And the principal investigator of this study was Dr. David Keast. And I'm Ashrafulisa Janmohammad, and today I'm recording this video with you. The purpose of this study was the marathon liquid skin protectant as it is applied around the wound which has exudate, like the liquid which comes out of the wound. Either it can be mild, moderate, or severe. This skin protectant, the marathon, is applied to those wounds, the skin around the wounds basically, which has a mild to moderate exudate. Now this wound protectant is actually a liquid glue which is applied around the wound, and it creates a small sort of I can say a gel, so which protects the wound skin, which is basically around the wound, so it is protected from the exudate of the wound, and it remains there for 1 to 3 days. So if it is applied for 1 day, it remains there for at least 3 days. Yeah. Now when we took this study, we registered for 10 participants, but in these 3 years we were only able to register 6 patients in the wound care. And this study was of 2 weeks, so we did not give that much time. So we, on the first visit, we applied that wound protectant around the skin, and we measured the PWAT, you can see, which is about the measurements of the wound basically, and PWSS is another tool which measures the skin around the wound, and it gives the structure, like what is the appearance of the wound, whether it is edematous, whether it is erythematous, or whether any infection. So all these kinds of recordings. So these are the main tools which were there, and we took the photograph on the first visit also, along with the second visit. Second visit was around 2 weeks after the first visit. Yeah, and we did all those things, but we did not apply the marathon on the second visit because that was our final week and we finished the study at that time. So it was a 2 week study, and we applied the marathon, which is the glue sort of a thing which is applied around the wound. And we measured PWAT and PWSS at the end, and we saw what has happened. Here you can see two pictures, like is pre, which is on the left side, if you can see this, and the post of that wound at the 2 weeks is in the on the right side in the first picture, and in the second picture you can see the top part is on the first visit and second part, which is lower one, it is on the post visit. Now before and after things, if you see that mean PWAT, the score which was actually for the wound, did not change, but the PWSS mean, which improved from 5 to 3. So 3 indicates that skin around the wound is getting better. Why PWAT did not change? We are thinking that as the wound window was very small, number one, it was only of 2 weeks. We did not give more time for it. And moreover, our sample was very small. We thought that we would be able to assess like in 10 patients at least, but no, it was only in 6 patients, number one. And number two, one patient even out of those 6 patients did not came for the second visit. So we had to exclude that pre and post test of that patient. So we assessed only 5 patients out of that 6. So mean PWAT did not change, it remained the same. But actually we are impressed that PWSS, which is a Peri-Wound Assessment Tool, which shows the improvement. So this shows us that PWSS has improved, and there are better prospects for this marathon applicator. And here I am presenting individual pictures like pre and post test, as you can see in all these 6 patients, and you can see number 5th, which did not came for the second visit, and that's why it is not coming up. As you can see, I've written non-applicant there. So as I explained that before, individual PWAT are good in all except one patient, but the mean PWAT did not change. And I explained you the reason for that before. PWSS changed, of course, and we saw that. So that is all for today. And if you have any questions, you can definitely ask me. And the final thing, the liquid barrier film protectant, which has protected the skin from the maceration of that exudate, which is mild to moderate, and that allowed healing to progress. It was easy to apply and caused no discomfort for the patients. So marathon was effective, as we understand that, and now this would be used whenever the samples are arranged. Actually, this marathon is not available in a formulary at the Parkwood Institute Research. So we'll see how that works in future for us. Thank you very much. Bye for now.